Welcome to the Lapbox manual training video. Before choosing to use the Lapbox device, visually assess abdominal cavity size. To determine device size compatibility. Abdominal cavity space should allow for adequate inflation of a cylindrical shape, measuring 17.4 centimeters width and 10 centimeters height. Use the side of the desired port to mark the final incision length. Place the tissue for removal in the cul-de-sac before device insertion and secure it with a grasper. Create the incision in the umbilicus. Insert the Lapbox system under direct visualization through the created incision, using rotating movements. If pneumoperitoneum cannot be maintained following insertion, use a clamp grasper to decrease the incision length. To deploy the Lapbox chamber, firmly hold the insertion shaft and push the handle forward to the maximum. Do not pull the tube back at any stage of the procedure. Place the organ within the chamber. If following the deployment, the chamber opening is upside down, rotate the outer tube until the chamber is in the correct position. Visually inspect that the chamber is not entangled. Always use an atraumatic grasper. After organ insertion, hold the chamber's opening adjacent to the abdomen wall by lowering the insertion shaft to ensure encapsulation. If the organ is too large to fit in the chamber, the Lapbox is contraindicated. Remove and discard the device. Attach the hand pump unit to the chamber using the designated connector. When connecting the hand pump assembly, hold the pressure relief valve for optimal connection. To ensure adequate inflation of the chamber prior to morcellation, using the atraumatic grasper, grasp the air tube adjacent to the air tube bend location and hold it to ensure proper airflow. Ensure the air tube remains open throughout the inflation process. If, during inflation, the inflation rate decreases, manipulate the grasper to adjust the tube and improve airflow. Under visualization, inflate the chamber by squeezing the Lapbox hand pump until a pressure of 150 millimeters of mercury is noted on the pressure gauge and the chamber is fully inflated. During inflation, if the chamber does not maintain a round shape, applies pressure on adjacent organs, seems to be sunken into the abdominal cavity, use a different device or convert to an open procedure. Visually confirming adequate inflation of the double wall chamber is imperative during the inflation process. Do not inflate more than 150 millimeters of mercury. Do not block the pressure relief valve. Make sure the chamber opening is facing upward during inflation. Increase the incision length to 3 centimeters for the medium port, white, and to 4 centimeters for the large port, blue, making sure not to damage the chamber. Extract the chamber's sleeve from the abdomen. Once revealed, grip the sleeve to complete extraction until the double-walled chamber is adjacent to the abdominal wall. Utilizing Alice forceps, grasp the instrument port and insert it through the Lapbox opening. If there are difficulties in port insertion, or if the port opening is not round, increase the incision, making sure not to puncture the chamber. If the chamber's sleeve is obstructing the view through the port, hold the port in place and pull the chamber's sleeve upwards until clear visualization is achieved. If the chamber is not round or fully deployed, first remove the port, then reinsert the sleeve, then insert the port, and then inflate to target pressure. Prior to initiating the morcellation procedure, visually confirm that there is adequate space for the device. If the device does not maintain a round shape, applies pressure on adjacent organs, appears sunken into the intestine, use a different device or convert to an open procedure. Start manual morcellation. If, during morcellation, an accidental tear is observed, increase the incision length and extract the chamber without further morcellation. If the chamber ruptures prior to the initiation of morcellation, extract the organ from the chamber and remove and replace the device. If the pressure gauge indicates 0 during the procedure, visually inspect that the chamber walls are inflated. If no problem is detected, gently pull the air tube 2 to 3 centimeters. Once the morcellation process is complete, the chamber can be deflated by disconnecting the hand pump. Make sure not to remove the port before deflation. Ensure bag is completely empty before extraction. If excessive resistance is encountered, extend the incision and remove the bag. Following removal of the chamber, survey the abdominal cavity for signs of adjacent tissue compression. If noted, consider additional patient monitoring for clinical sequelae. Thank you for watching.